I've been interested in the foot and ankle. I think it's very important, especially from a sports perspective. To everyone, foot and ankle is important. If your feet aren't feeling well, then certainly the rest of you is not as well. And I think it goes along with other joints in helping them out, and so I think it's a vital part of maintaining health. A lot of times I see ailments that are acute and sometimes chronic, and for the things that I treat, a lot of times I can make the patient feel better when they leave the office than they did when they came in, and so that gives me a lot of satisfaction. I like to involve my patients in their care. I like to give them all reasonable options and make them feel like they're involved in the care and not just sort of following directions, and I think when they're more involved, then they get a better result. Within the foot and ankle, I do conservative and surgical treatments, but my interest mostly lies in surgery, minimally invasive procedures, arthroscopic procedures, injuries to athletes that are chronic injuries like osteochondral injuries and ligament injuries in the ankle that sometimes get missed that I pick up on and I can help patients recover from. I serve as a peer review editor for the rear foot and ankle traumatology sections. And so I keep abreast of the literature that way because I do a lot of journal article review to kind of help decide whether or not articles are going to be accepted for publication and give feedback on that from a scientific standpoint. But then I also keep abreast of the newer treatments by just doing journal reviews and keeping track of the publications. It's important for the doctor obviously to offer and give all the treatments that are necessary and lay out the plan. But I think it's important for the patient to be involved in patient care, take an invested interest. Otherwise, they generally don't do as well, and so I like them to be active participants. And they generally get a better response when they feel like they're taking responsibility for their condition.